Our intervention offers a solution to the lack of access to primary care and a desire for in-person interaction.
Let's meet the design team. We have Christina, Chloe, Mariana, and Nana.
Health on the Move / Health as Life takes us back to the roots of healthcare delivery, emphasizing the importance of in-person, hands-on care. This approach values the human connection and invites us to reflect on the irreplaceable value of personal interaction in the healing process.
Many Americans, especially in rural areas, struggle to access essential health care due to gaps in coverage. Around 30 million remain uninsured even with the Affordable Care Act, with low-income individuals facing challenges like affording copays, prescriptions, and transportation to medical appointments.
What if our healthcare was a reflection of our everyday life and the clinic wasn't just a building? What if we could access healthcare at any place and at any ordinary touchpoint we encounter in our day-to-day activities? How can we explore opportunities at the intersection of healthcare in and healthcare on public space? How can we potentially champion different forms of public space as conduits for primary healthcare? Finally, are there placemaking efforts that can help contribute to fostering this as an avenue for a hyperlocal model of healthcare?
Pop-up clinics as a form of tactical urbanism are community-driven initiatives that highlight overlooked areas, address neighborhood concerns, and showcase desired improvements. These clinics help bridge the gap for those without health insurance by making care more affordable and accessible. By reducing transportation barriers, mobile clinics can improve health outcomes, tackling life issues like life expectancy disparities and preventable illnesses.
The U.S. Army created field hospitals to address challenges during COVID-19. These hospitals had triage and intensive care units tailored to the specific needs of the area. Deployed in Central Park, mobile units were inflatable structures with canvas covers, while trucks transformed into intensive care units when empty. The 20XX report underscores the importance of quality care and short wait times, with meaningful interactions between patients and physicians being the most important.
Our design, named the Community Care Cruiser, offers a solution to the lack of access to primary care by offering as many touch points as possible. Along the healthcare continuum, primary care can now be in your grocery store or parking lot. Health can be framed as life and healthcare moves to a more preventative model of care. A person's lifestyle is now providing their primary care in multiple ways and places.
So, what does this model of primary care look like in the now, in the near, and in the future?
The Community Care Cruiser aims to address healthcare gaps by leveraging GIS mapping to identify areas of need. Using the health grade RVO system, we locate healthcare professionals for further assessment. We prioritize areas with limited access, like in Detroit, with low income and life expectancy. These areas become our trial sites with flexible scheduling, accommodating diverse community needs. Our approach creates a network of care, with each location mapped for the cruiser's outreach. We work closely with clients, using a design matrix to tailor healthcare solutions to their specific goals and spaces.
We'll transform our design in the next 5 years into reality, with prototypes of our Community Care Cruiser hitting the road. Our adaptable units will serve both rural and urban areas, deploying in various locations like grocery store parking lots or parks. Technology enhances in-person interaction rather than replacing it. The truck isn't just a vehicle, but a hub for collapsible modules that expand into community spaces for workshops and social gatherings. These spaces will feature flexible seating and interactive displays to foster community engagement and well-being. A portion will include mobile gardens for teaching about healthy eating and sustainable living.
As you enter the space, it's accessible to all ages, and you proceed through check-ins efficiently. Afterward, you are welcome to relax in our outdoor resting areas, where various activities are offered. Following this, you will head to the examination room for a checkup. Alongside the parks, you can enjoy our truck with artwork.
In the long term, we're integrating resiliency planning and disaster preparedness into our project to mitigate climate change and public health emergencies over the next century. Our aim is to make the project adaptable to evolving healthcare needs and changing physical environments. We'll engage in global health initiatives to address disparities and promote equity worldwide. Adaptability and resilience are paramount following the 20XX model of care. It's more than a pop-up clinic. It's a vital part of community health, serving as connective tissue for wellness.
Our design outcome draws from past research showing the positive impact of pop-up interventions on urban and rural healthcare adequacy. Incorporating green space benefits health by reducing heart rate and blood pressure. Mobile primary care has been found to improve overall population health, while community engagement correlates with longevity. Moreover, evidence suggests that mobile interventions reduce healthcare costs compared to inpatient and emergency care.
Thank you for your time.